Hi, my name is Monica, and the article I chose is about how robotic surgeries are transforming patient care. Many institutions, including Yale New Haven Health, that is discussed in this article, have been adopting the use of robotics in healthcare and seeing promising results. The shift to robotics represents a commitment to patient-centered care, enhanced surgical precision, and operational efficiency. Yale New Haven Hospital currently uses a Da Vinci surgical robot. Now, these robots are being integrated into daily practice, allowing surgeons to perform complex procedures with greater control and fewer complications. Robotic surgery leads to shorter recovery time, reduced hospital stays, and ultimately better patient satisfaction. Robotic surgeries also increase accuracy during procedures. The typical robot-assisted surgery has a surgeon sitting at a console who's controlling the robotic arms that holds surgical instruments. A high-def 3D camera provides a magnified view of the surgical site, allowing the surgeon to see minute details, and this is done through small incisions. The robotic arms mimic the surgeon's hand movements, but with greater dexterity and steadiness. So this reduces the margin for error and allows for minimally invasive techniques, which ultimately means less pain and quicker recovery for patients. Another positive about this is that it has significant ergonomic benefits for doctors who are typically on their feet for long hours in demanding positions. Some surgeries are over 10 hours. Robotics helps alleviate these stresses and allows surgeons to maintain high precision and focus without suffering from the physical toll of traditional surgeries. Robotic systems reduce the likelihood of complications such as blood loss or infection, and because of surgeries being performed through smaller incisions, it also minimizes scarring and accelerates healing. These technological advances impact patient times because patients can now return home earlier, they experience less postoperative pain, and resume normal activities faster. This article is important because it shows how technological advancements can create safer and more efficient procedures that can help increase patient satisfaction. This can also take some of the physical burden off of surgeons who put their body into compromising positions for a long time, creating the possibility for injury or mistakes to be made during a long, complex surgery. The implications of this technology has on delivery, coverage, or access has to do with the cost for this technology. It's very expensive, and it's one of the technologies where every time a new generation comes out, the price just keeps going up. So not every facility can afford to have one or afford the upkeep. And in regions with limited resources, the high cost of this technology can be a barrier to wider adoption. My concern is that since the technology is so expensive, for the hospitals that cannot afford to purchase this technology, what will happen to them if they can't compete with the hospitals that can afford it? My other concern is that technology like this is not always perfect, and it can malfunction during a surgery or take a command incorrectly. We just don't know enough of how to make sure that that doesn't happen and what to do if it does. The only question that this article left unanswered is about training. There needs to be rigorous training for this type of technology. Is there a standard training across the board from state to state? The use of robotics in surgery is a huge step forward in healthcare. It allows surgeries to be less invasive. It reduces the margin of error because of the dexterity and the steadiness the robot can operate with. And it also allows for a quicker and easier recovery with less pain for patients, leading ultimately to overall better patient satisfaction. There's also less opportunity for infections to develop during surgery. It's unfortunate that the technology is so expensive, but the reward that comes with using it is very valuable and overall seems very reliable. It also takes some of the physical burden off of surgeons, allowing them to perform more complicated surgeries over their career at top performance. I think that this is a positive step forward into the future of healthcare delivery. Thank you.